to investigate the upper limb, we're going to start with our clavicle and scapula, which are going to connect with the humerus here at the shoulder joint. Humerus heading down is going to articulate with the radius and ulna at the elbow, and moving to our wrist we're going to have our carpal bones in the hand, and then the metacarpals and phalanges going into the hand and fingers themselves. We'll begin with the clavicle. It has a proximal end here where it articulates with the sternum, a nice little S curve to it as it comes out here distally, where it will associate with the acromion of the scapula. Now if I put the scapula here, we'll kind of stick those together and you can kind of see how they articulate, but it works a little bit better if I rotate it this way and we can get a sense for how those articulate. And remember, the clavicle is the only bony attachment that the scapula has to the rest of the body, so otherwise it's held there by muscle. Taking a look at the scapula, it's roughly triangular in shape, and we can see it has a medial border, lateral border, and a superior border. The medial and superior border meet at the superior angle, medial and lateral borders meet at the inferior angle, and here, laterally, it's pretty complex. So I want you to note, right here we have this notch, followed by this large thumb-like kind of extension of bone sticking up. That is the coronoid process. So it's sticking up here, just superior to where we have the glenoid fossa. That's going to be the place where it articulates with the humerus itself. Now it's important to distinguish the coronoid process here from this other strut of bone, that is the acromion. And if we flip the posterior side, we can see the acromion is really just the continuation of this big strut of bone here called the spine of the scapula. So the spine of the scapula is connected to it here, but then the acromion lifts off to articulate with the clavicle, and that leaves us with an infraspinous fossa here and a supraspinous fossa here. And if we flip over to this side, this entire surface here is known as the subscapular fossa, and these are all places where rotator cuff muscles are going to attach to help us keep the humerus in the glenoid fossa. Speaking of which, let's add the humerus to the equation now, and we can see how the head of the humerus fits into that glenoid fossa right there. And the head of the humerus is this large articular surface right here. Let's zoom in just a little bit. And we can see that the head of the humerus has the articular surface here. There's two bumps, a lesser and greater tubercle on either side. There's a groove between them called the intertubercular sulcus. And as we travel down the lateral side, there's a roughened area here on the shaft. It's not too obvious on this specimen, but sometimes can be. And that's called the deltoid tuberosity, and is where the deltoid muscle is going to insert. The distal end of the humerus is pretty complicated. We've got an articular surface here for the ulna and the radius. And this whole area is sometimes known as the humeral condyle, even though we have a separate trochlear area and capitulum to articulate with the ulna and radius respectively. And where we have these large struts of bone, we can usually be pretty sure that we've got muscle attachment happening. And this is called the medial epicondyle and the lateral epicondyle just here. Now if I flip to the posterior side, you can see there's a nice big depression here, and that is so that we have a place for the ulna to articulate posteriorly. So we'll put that in there. And we can see that the ulna, as it flexes and extends at the elbow, needs to have room for this large process to go somewhere. That large process is called the olecranon process, and our tricep muscles are all attaching there. We then have a trochlear notch where it articulates with the humerus, and just here there is an ulnar tuberosity for muscle attachment. So here, as we continue down the shaft of the ulna, we get to its distal end called the head. So the head of the ulna is actually distal. It's further away from the body. And another little thing we have to note here is this little strut or spike of bone called the ulnar styloid. Now let's take a look at the ulna from a more expanded view and put it in connection here with its buddy, the radius. So the radius and the ulna really do operate together. The radius articulates with the radial fossa of the ulna, and the radial head is what fits in there, and they're articulating both proximally here and distally down here. So now let's take a look at the radius specifically, and we'll note that it's got a very pronounced kind of bulbous head just up here. So the radial head is actually proximal. Then there's a narrowing, the radial neck, and a nice big muscle attachment site here, which is going to be the radial tuberosity. Again, we have the shaft of the radius coming down, and distally it flares out pretty significantly, and we're going to have a little spike here on the lateral side. That is the radial styloid process. And then we have this surface here where it articulates with the actual carpal bones. So the carpal bones will be articulating with that distal radius pretty significantly, and a little bit with the ulna through a cartilage disc that'll actually be located in here and deepen that articulation a bit. So now let's take a look at the palmar side of the carpal bones here. So the proximal row, we have 4 bones, and then the distal row we have 4. We have the scaphoid, the lunate, the triquetrum, and the pisiform. And the pisiform bone kind of sticks out a little more anteriorly, so it's a little bit of an outlier there. So we've got those 4, scaphoid, lunate, triquetrum, pisiform, and then, get a little centered here, if I can figure out how to get that going. This distal row, we have the trapezium, the trapezoid, the capitate, and the hamate. And the hamate has a hook that also sticks out anteriorly. So we can see both the pisiform and hamate sticking out anteriorly. Now, once we leave the carpal bones, we enter the hand itself, and the bones of the hand itself are called metacarpals. So the metacarpals each have a base, a body or a shaft, and a head. And we've got a metacarpal for all 5 digits, 1 through 5. And then from the metacarpals we have our phalanges, singular phalanx, but we have phalanges going to form the actual bones of the fingers, and the thumb has a proximal and distal, whereas the other fingers have a proximal phalanx, intermediate or middle phalanx, and a distal phalanx. And just like the metacarpals, they have a base, a body, and a head. Just to make sure we're covering all our bases, let's look at those structures again, but from the dorsal side, zooming in here. And now we can see on this side we have the scaphoid, the lunate, the triquetrum. Remember, pisiform, it's sticking out anteriorly, so it's a little tough to see here. We have to rotate it to bring that pisiform bone into view. Then, starting with the thumb, we have our trapezium, trapezoid, capitate, and hamate. Then we've got our 5 metacarpals, each with a base, a body, and a head. And then our phalanxes, 2 for the thumb, proximal and distal, and 3 for the other digits, proximal, intermediate or middle, and distal phalanx, each with its own base, shaft or body, and head. We'll now take a look at the bones of the lower limbs, starting with the hip bone, or os coxa, and the 3 fused bones that make it up. Moving on to the femur, large bone here, articulating with our kneecap or patella, before moving on to the tibia and fibula that are going to articulate with our tarsal bones, and finally our metatarsal bones and phalanges. The os coxa is a truly strangely shaped bone, and it's got an auricular surface here that corresponds to the auricular surface of the sacrum, and those two articulate right there. The inner side of this large bone here, the ilium, contains a surface for what's called our iliacus muscle. Then as we move down into the true pelvis, we have our pubic bone here making a V anteriorly, and our ischium here coming around this way. If we take a look at this side of the ilium, we can see there's a nice pronounced anterior superior iliac spine, slightly less pronounced anterior inferior iliac spine, and on the posterior side, a posterior superior and posterior inferior iliac spine. The ischium has this spike associated with it, the ischial spine, and then this large roughened area here, the ischial tuberosity, where the hamstring muscles are going to attach. The ischium and pubis enclose another space here. This is called the obturator foramen. And if we flip to this side, we can once again see anteriorly we have our pubic bone with a roughened pubic tubercle in front, this little bump pointing anteriorly. We can see the roughened portion of the ischial tuberosity a little more clearly here. And on the outer side of the ilium, we can see the gluteal surface where some of the gluteal muscles attach. I want you to note that between our posterior superior and anterior superior iliac spines, we have this large circular, or it's kind of semicircular crest. This is the iliac crest, and it's a place where our abdominal muscles are going to attach. So iliac crest, large bony feature there, and the ilium, the ischium, and the pubic bones all come together to form the acetabulum. This is the articular location for the head of the femur. And we can see here the head of the femur fits into that pretty nicely to allow the ball and socket joint to do what it needs to do. The proximal femur has a lot of different features. First and foremost, we've already said we have the head of the femur here where the articulation occurs, then the narrower neck, and here we have the greater trochanter, large bony attachment point, and medially the lesser trochanter, another important point for attachment. Posteriorly, we have multiple bony features that we can go into more detail with later. I want you to note on the posterior side, we have a roughened area extending all the way down called the linea aspera, right here. And there's a roughened area at its very topmost point called the gluteal tuberosity. Otherwise, the shaft of the femur is fairly uniform until we come down to its distal end, and we have the femoral condyles. We have a lateral and medial femoral condyle. They're both going to articulate with the tibia. But if we flip, you can see just how extensive those condyles actually are. They're very large, rounded structures that project posteriorly. And there's an intercondylar region right here that's going to be where some of our important ligaments are located. We'll now bring in our tibia. Now we're looking at it on its posterior side just now. So the tibia and femur articulate in this manner. So we have the two femoral condyles. I've turned it so that we have the medial condyle here and the lateral condyle here articulate with the medial and lateral tibial condyles. We'll flip this over to the anterior side now, and we can see that we have, in addition to those condyles, a little roughened area here in between them. This is the intercondylar eminence. So we got our condyles on either side here. Normally in life there would be some cartilage in this area called menisci on the medial and lateral side, but we don't see that on these dry bone preps. And very anteriorly here we have our tibial tuberosity, and that's going to be where our patellar ligament is going to attach. The patella is a very interesting bone in that it's a sesamoid bone. It's a bone that exists inside a muscle or ligament of another bone. So the large quadricep muscles that come down contain our patella, and it's going to be articulating with the femur here, and then from the patella we have the patellar ligament attaching to our tibial tuberosity. So let's just take a quick look at the patella before we move on to the other bones of the leg. And the patella has an apex. Now most of the time when we think of the word apex, we think of something pointing upward. But in the case of the patella, the apex is actually pointing inferiorly towards its attachment to the tibial tuberosity. If we flip it onto its articular side, we can see that it's actually got a little bit of biconcavity going there. It's kind of pushed in on two sides, and that's because it has to articulate with both the medial and lateral femoral condyles and slide along them as the knee moves through extension and flexion. We're now coming back to a zoomed out view of the tibia facing anteriorly. I want you to note from the tibial tuberosity proximally, we have the shaft of the tibia leading down here, and at its inferior side, we're going to have a large extension called the medial malleolus. So this side has to be medial, so that tells us that we're dealing with the left side. So we'll now take a left fibula and articulate it. Fibula kind of looks a little bit symmetric from top to bottom, but there are some differences between the upper part, the fibular head, its shaft, and then the inferior part, the fibial malleolus. So the fibula, its head, articulates with the articular surface of the tibia. That's going to be very superior here, so we'll zoom in a little on that. And that is going to be a synovial joint. So the fibula does not directly connect with the femur. Instead, it's a little more inferiorly here, having an articulation with the tibia. So here we can see distally the lateral malleolus of the fibula, medial malleolus of the tibia, and the mortise, or the articular surface, formed by the two of them. And they are going to articulate with the most superior of the tarsal bones, and that is called the talus. So they're going to sit in that space together and allow dorsiflexion and plantar flexion of the ankle. So let's take a closer look now at the tarsal bones and the other bones of the foot. Turning it sideways, we can see that we've got the talus here. More inferiorly, we have the calcaneus, or heel bone, with its very large calcaneal tuberosity. And when most people talk about their heel, that is exactly what they're talking about. Large bony protrusion that helps us bear a lot of our weight and serves as the attachment point for our calcaneal or Achilles tendon. So once again, calcaneus here, very large, talus here, and then we can see that we have other bones going forward from the talus. We have the navicular bone here, and just anterior to it we have a medial cuneiform, an intermediate or middle cuneiform, and a lateral cuneiform. And completing that row is the cuboid bone here that's articulating with the calcaneus just a bit more posteriorly. Now from our tarsal bones, we move to our metatarsal bones, and they're very much what we'd expect, and they're very similar to the upper limb, where we have a base, a body, and a head for each. And then we have 3 phalanges for digits 5, 4, 3, 2, but one, the big toe, only has 2. So just like we did in the upper limb, let's flip and look at this from the inferior side now, or the plantar side, and we can see just how huge the calcaneus is. And I want you to note, it has a shelf here that supports the talus. So the talus actually rests on that shelf of the calcaneus. This is called the sustentaculum tali, and the area of the talus here that articulates with the tibia and fibula, that is going to be called the trochlea. So the trochlea of the talus there. And then, moving anteriorly, once again, we have our navicular in front of the talus, our cuboid in front of the calcaneus, anterior to it. Then we have our medial, intermediate, and lateral cuneiform bones before we get to the metatarsals, base, body, head, and our phalanges. 2 for the big toe, 3 for all the others. And the very last thing I want you to note is that the 5th metatarsal has one feature that the others do not. It has this large tuberosity where we have a muscle attachment occurring. So that is going to be the tuberosity of the base of the 5th metatarsal.